on the first day of the World Antimicrobial Awareness Week, and our webinar titled Why Infection Prevention and Control Expertise Matters to Combat Antimicrobial Resistance and Prevent Outbreaks. It gives me great pleasure to have you with us today on this specific webinar and with our esteemed speakers and panelists. Before I go into the program and the details, I'll hand it over to Bruce for some housekeeping comments. Over to you, Bruce.
Great, thank you, Hanan, and welcome everyone. Just going to review a couple of housekeeping items. We have interpretation available for Arabic, French, Portuguese, Russian, Spanish, and you can access that through the interpretation feature at the bottom of the Zoom toolbar. For Arabic, please select the German channel. And if you have any questions about that, just chat them to us in the chat. We really look forward to your questions and comments, so please put those in the Q&A feature, also down along the bottom of the Zoom toolbar. As I said, if you have any IT or other logistics questions, please put those in the chat. This session is being recorded, and your attendance is consent to be recorded. Thank you for that. Thank you for joining. There will be continuing professional development credits available through the University of New Mexico, where Project ECHO is based. And about 15 minutes before the end of the session, we'll put a link to a brief survey, and you will be able to download an instant CPD certificate after completing that survey. And we really appreciate the feedback you give us through that. Just a quick note about the data. When you registered, when you put data in the chat and the Q&A, we want to remind you we take data stewardship very seriously, and we will not be sharing any identified data in any way. So with that, I'll bring that to a close and hand it back to Hanan, and thank you.
Thank you, Bruce. Thank you very much. Very helpful. Once again, I'd like to welcome you to this major event during World Antimicrobial Awareness Week. And we still have people joining now. We're at 280 plus. So I am, by way of definition, my name is Hanan Balki. I'm the Assistant Director General for Antimicrobial Resistance, based here in Geneva headquarters. And this event was organized and planned by the one and only Dr. Professor Benedetta Allegranzi, along with the esteemed staff that we have with us today. So very briefly, we have with us Professor Muhi Majdoub from United Arab Emirates, professor with a very long history in medical education in the Emro region and in multiple countries around the world. We have Professor Sade Agonsola from the University of Lagos, who's also the head of the Infection Control African Network. We have Professor Dale Fisher, chair of the steering committee of the Global Outbreak Alert and Response Network from the National University Hospital in Singapore. We also have Nico Mutter, University of Bonn. We have Ermira Tartari, University of Malta, who's also here with us in University Hospitals of Geneva. And we also have from our Euro office, Ana Paula Coutinho from the Euro office with us as well. The program, as you will see it today, it will start by a presentation from Benedetta Allegranza, the head of the Infection Control Hub here in HQ, on the new WHO core competencies for IPC, and that will be followed by a panel discussion. So please feel free to raise your hand once Benedetta has finished, or type your questions in the comment section. With this brief introduction, welcome again, and I'd like to hand it over to you, Benedetta. Thank you, everybody, and enjoy.
Thank you very much, Hanan, and thank you all panelists for participating. So now I will share my screen and my presentation. If you can hold on one second. Okay, so as Hanan has anticipated, we are very delighted to have been able to issue a couple of months ago this new document, which is called WHO Core Competencies for Infection Prevention and Control Professionals. This document was developed as a joint product and project, which has many more actually plans for the future between the Infection Prevention and Control Hub at WHOHQ and the AMR division, working together to gather input from other documents and also from experts, some of whom are also represented here in this panel, in order to agree upon what are the WHO core competencies for IPC professionals. This is the first time WHO produces this type of document. You may know that other organizations, one among them, the European CDC, have remarkable documents on IPC core competencies and curriculum. So we were inspired by these other organizations, and also we gathered important input by many experts. So the starting point is what is written in many of our documents, recognizing that infection prevention and control is a practical, evidence-based approach and discipline that prevents patients, health workers, and others from being harmed by avoidable and preventable infections. So as I said, we recognize IPC as a real discipline, and this is why we believe that it was important to identify the core competencies for the specialists who are in charge of IPC and are named as IPC professionals. This need is deeply rooted in the Bible, so-called for IPC at the moment, which are the WHO core components for effective IPC programs. In fact, if you look at core component 1, which is IPC programs, the recommendations in this core component clearly highlight that IPC programs are to be led and managed by dedicated, trained IPC professionals and teams, both at the national and at the facility level. So already in this document, in the WHO guidelines on core components, we defined who are the IPC professionals, and we will discuss this later. And also we defined strong recommendations for countries to have IPC training and education. Training and education that needs to be not only knowledge, but also clinical practical skills and training that must be conducted for different levels of trainees, from pre-graduate to postgraduate to in-service training. So there we defined also that there must be an IPC postgraduate curriculum in all countries. And this means also that there should be career pathways for these IPC professionals who become specialists in this field. And so I wanted to highlight these core components because this is the basis for having developed the IPC professional core components, core competencies. And in fact, you may know that there are also minimum requirements for components, and the minimum requirements say that in all countries, as a minimum, you need to have an IPC national curriculum, and at the facility level, you need to have IPC staff who have specific IPC training at all levels. So the curriculum and the IPC core competencies are really meant to support this agenda and make it happen in countries even if, of course, we know it's quite difficult to be achieved nowadays. Only a few countries really have an IPC postgraduate curriculum or specialization. And this is the gap that we would like to facilitate to be bridged. So this is why we started by issuing this document. The purpose of which, first of all, once again, is to define who is the IPC professional and identify what core competencies are needed to be qualified in this discipline and at what level, because we distinguished between a junior versus a senior level of development. The goal of this document is to support achievement of the specific expertise and competencies of IPC professionals needed at the country and the facility level. The document is meant to be used by different audiences. So, of course, it's for IPC, for those in charge of IPC programs to know which competencies they are meant to have. Those who also would like to become IPC professionals to understand which are actually, as I said, competencies that they need to acquire. Those in charge of developing the curricula, so in charge of IPC postgraduate education and training, but also at the country level, those in charge of human resources for healthcare and in charge of developing and strengthening IPC program. These decision makers really need to understand that IPC is a discipline and IPC professionals should have specific competencies. Of course, this document may be of interest also for those responsible of other areas that are complementary to IPC, such as quality, patient safety, public health, WASH, occupational health, antimicrobial stewardship, etc. So this is the target audience. Now, in this document, but also in previous documents, we defined who are the IPC professionals. They are healthcare professionals, either doctors or nurses or even other health-related professionals who have completed a certified postgraduate IPC training course or a nationally or internationally recognized postgraduate course on IPC, or another core discipline, including IPC as a core part of the curriculum. So this is the part of knowledge. And then this is combined as a requirement with IPC practical and clinical training. So it means to have a certificate or to have a diploma in a recognized course or in another discipline, which could be, for instance, infectious diseases, which has a very important element of infection prevention and control, and also have IPC practical and clinical training. So this is very important because we are aware of the fact that not many people have these, but we really need to achieve this in the future as a goal for all of us. So the document also defines 2 levels. So the junior level is identified as newly appointed IPC professionals with up to 3 years of practical IPC experience, plus obviously the certification or diploma as previously described, or the level 2 or senior level, which is defined by a professional with more than 3 years practical IPC experience, and also including higher levels of education in critical fields such as epidemiology, infectious diseases, public health, quality improvement, and demonstration of the capacity to take on senior leadership roles and responsibilities. So what are the core competencies now? Core competencies refer to the knowledge, skills, and attitudes required of an IPC professional to practice with an in-depth understanding of situations using reasoning, critical thinking, reflection, and analysis to inform assessment and decision-making in the prevention and control of healthcare-associated infections and AMR. And in fact, when we talk about skills and attitudes, these are attributes. It means, for instance, acting as a role model, visible advocate for IPC, quality of care and patient health worker safety, encouraging individuals and teams to learn and develop IPC best practices, appropriately communicating about risks and recommended IPC practices, while being able to explain the evidence basis, and supporting individuals and teams with audit, surveillance, and feedback. Behaviors, again, only some examples. It can be much broader than this. Behaviors for IPC professionals are to be passionate, advocative, persuasive about the importance of IPC, being accountable for her own actions, approachable, communicative, thorough, and perceptive. We discussed many times that infection prevention and control is a discipline that, to be implemented, requires a multidisciplinary approach at the facility, but also at the national level. It means to be really able to integrate with other disciplines and collaborate with other programs in order to avoid duplications, but especially to enable embedding IPC in clinical practices, in other programs, such as, for instance, surveillance for antimicrobial resistance, as an example. So these attributes and behaviors are really key to achieving this approach of integration. They are really fundamental for the IPC professional. To conclude, in this document, there are many areas and domains which are detailed, and I certainly don't have time to go through each one of them. But basically, there are 5 areas which go from leadership to IPC program management, microbiology and surveillance, IPC in clinical practice, education, and then the contribution to areas such as quality, patient safety, and occupational health. Each of these areas have different domains that we detailed in the document. In fact, to give you an example, each domain has a summary, which is here on the screen, for instance, for the IPC program management and leadership. And then the competencies are detailed according to what you need to achieve as knowledge. So every time it is written, to achieve this competence, an IPC professional needs to demonstrate updated and evidence-based knowledge of a number of principles that are listed for the specific domain. But as we said, knowledge is not enough. You also need to be able to demonstrate ability to undertake a task or to implement that area or that domain, or contribute to its implementation, achievement, etc. So this is more practical. So as I said, whereas the points that are under knowledge are mainly theoretical knowledge that you need to have, in parallel, you have a number of examples and areas which are for demonstrating your ability to operate in those areas, to implement or to contribute to implement regarding that area. So each chapter of the 16 domains is constructed in the same way, with a competence summary, and then one part that is related to knowledge and one part that is related to ability to successfully undertake or contribute to specific tasks. And this is, again, what I just mentioned. So we divided the various areas in policy and guidance, or general basic principles, leadership and implementation, education and training, communications and advocacy, and monitoring. These are the main fields where every single domain is detailed regarding the IPC core competencies. Also, before I close, I would like to remind you that WHO developed different IPC advanced training packages, which are currently available in e-learning format, but also most of them are also available as training packages to be delivered in person. And of each package, for each package, there is a slide deck, trainer's manual, students' handbooks, and in some cases, videos and other tools. And all of these tools are also for enabling practical training with some case studies, some exercises to be used, some simulations that are suggested during the in-person training. Also, just to remind you that WHO has different online training courses in the context of COVID-19, but also basic IPC, such as hand hygiene, standard precautions, basic microbiology, and other aspects, which are all available at the 2 links that you can see in this page. With this, I would like to conclude my presentation, thanking all of you for listening to me, in particular thanking a colleague who worked with me on this document, Christine Francis, and Hanan Baki, again, working with us on this document and providing her leadership. In this slide, you can see who are the contributors, many people from different organizations who provided consensus on these core competencies. So we really hope that this document can be useful at the country level, but also at international level for organizations which are leading or developing training courses or certificates for IPC. So now, with great pleasure, I would like to maybe stop sharing my screen and move to the panel. So as we said, we are privileged by a great panel today with whom we would like to discuss some questions. I also would like to remind participants that they can write questions in the Q&A function, and I will monitor the questions and extract some questions to be asked in addition to the ones that we prepared. But also the panelists and also my colleagues, Ana Paula and Hanan, will look at the Q&As and provide you with some answers if appropriate. So now, you heard from Hanan that our 5 guests are all people who have strong expertise in training and education. Particular Professor Maghzoub is the only one among us who's not an IPC specialist, but he is a specialist, an expert in education and adult learning. He has a lot of experience in developing curricula, and he's currently working with WHO, with our group, to develop, further develop an IPC curriculum. So today, I would like to start with him, asking him why, in his opinion, is it critical to have a standardized multi-professional IPC curriculum, and also what strategy should be used to put it in place at the country level. So Professor Maghzoub, could you kindly give us your advice on this?
Okay, thank you so much, Benedetta. I think really your presentation cover very comprehensive and cover most of the topics that or the points that I would like to address. I think first, really, to answer this, I'd like first to congratulate the team that you put together really. So far, you have developed really a lot of materials, a lot of interventions regarding training and education for different health professionals, not only IPC professionals, but also for across the whole profession. And as you know that IPC is really the cross-cutting specialty through all health professionals, particularly with COVID. Now also other people outside the health profession also they came on board, including politicians, decision maker, policy maker, at national and international level. So now it's really IPC is look at emerging, fast-growing specialty because this is really, as you have mentioned, with the new emerging diseases. So it's put it really top on the agenda of all states. To answer the question, I think the multi-professional IPC, and I think it's really multi-professional. And if we just can categorize who are the professions related to IPC, just to give a background really to my answer, is that the frontliners, this is professional, this include IPC, and those who are working directly on IPC, and then followed by them the second liners. This is who are health other professionals and supporting, for example, nurses, radiologists, and part of the, and the third liners, this is really those who are sectors or multi-sectorial sectors which related to health like veterinary and agriculture and others. And the last group, the community at large. And I think really if we have to address training and education, we have to consider all this group because this is really concern for everybody and everybody should receive training. And then we design curricular on all these, for all these categories. It's really multi-professional, and that we start with the interdisciplinary, this is within the health professions, and also multi-sectorial outside the health professional and the community at large. And I think this really, we need a framework if we want to approach this really in a systematic way. And I think that if we can consider the health work lifespan, which start from entry to practice to exit of health professional, and then at each stage of development, then a curricular could be really standardized and adopted at each level. For example, at undergraduate level, that the IPC professional curriculum and other sectors. And at practice level, that's the CPD and life learning strategies for IPC, and also even at the exit part, when even for retired people or those are unemployed, because we need them in crisis. For example, when health professionals are really working on the front line. So I think it's really, this is, we have to consider all this part. And I think this really represents a very good health work. To come to the second part of your questions, really, what are strategies that can be adopted at country level? But I think before going to that, there is also very important strategies has to be adopted in international level. For example, this is really, for example, for accrediting, international accrediting bodies, WHO, and also sister organization in UN, and so that as international level, we as world community, we have to come together, having standards. And as you have initiated, for example, the competencies which you have initiated is really a very important step for curriculum development. And this is really has done at international level, and then can be translated to state level. The other things which we can do at international level, which can help also countries and states, like, for example, creating standards for accreditation. For example, now in medicine, for example, if I can give example, that the WFME, World Federation of Medical Education, are developing standards, across to be adopted by accrediting bodies at the state level, which really guide curriculum design at the same time guide accreditation. And I think this really, if we impose it through accreditation, I think automatically medical schools and other health profession education, even IPC, this really was more likely to adopt it within their the sub-standard. And then also you have to create standards as well at international level for IPC specific health professionals. And this is really very important steps also for curriculum design. Other strategies, which is we have also to work downstream as also as upstream. For example, we cannot really have a health professional before we secure job for them. This is why we have to work with regulatory bodies to create a career path. I think this really may be a prerequisite for developing education, that when those IPC specialists graduate, they will easily find a job when they graduate. So I think this is also important strategy which can be done at international level. And then coming to the states level, this is really important intervention that translates the international intervention, which I just mentioned, to state levels. And this, for example, like working with local accrediting bodies, working with regulatory bodies to recognize IPC professional, as well as local accrediting to recognize standards for which you can guide education. And then how we develop then steps that we can develop the curriculum, which we already did a very big step, which is the competencies. And the competencies, these are the outcomes. This is where we start our curriculum. So that we have to start with competencies, and these competencies will be translated into program learning outcomes, which will be translated into the course learning outcome, educational strategies, as you know, assessment strategies, and as well as the curriculum delivery strategies. So
okay, yeah, thank you so much. So sorry for interrupting you. If it's okay, you gave an incredibly broad and very detailed overview of all steps. I really hope that there are people listening who may be in charge of at the national level, at the country level, or in international level of developing a curriculum for IPC, because all what you said is really super relevant. And if it's okay, I'll move to the other panelists and we may go back to these various directions you gave at the end. And in fact, this gives me also the opportunity to say that we are working with you, Professor Mazoub, to really put in a document all these various directions that you listed, so that people will be able also to really follow the directions you were advising. So many thanks for the moment. And I would like to move to Professor Ogunzola. And in fact, Shade, I see in the Q&As, there are many people who are, as expected, unfortunately, telling us that IPC courses are not available in countries by universities, especially low middle income countries. And in fact, I know that ICAN, the Infection Control Africa Network, you are the president of, over the last probably 20 years has tried to bridge these gaps, especially in Africa. And so my question to you would be, what have been the challenges that you have experienced in this work with ICAN in Africa? Shade, we cannot hear you.
Sorry, I was muted. Yes,
No.
Thank you very much for that question. So that I put it in context, for those who don't know ICAN, we've been in existence for about 10, 12 12 years, but we've all been working in this field for a very long time. And our vision is to have an African continent where safe patient care is assured by implementing evidence-based IPC programs and training. And we believe that in low and medium income countries that we can actually achieve the goals of IPC, even with minimal resources. Well, the major problems that we have found is the perception of IPC. On the continent as a general rule, people see IPC as a response to a public health emergency, to a public health epidemic, so that in between epidemics, nothing much is going on. And what we have sought to do is to change that perception. And we have created a lot of training programs, and I'll still speak to this in a little while. We have training programs at a basic level that introduces you to IPC. We have training programs that are in different aspects of IPC. But the biggest challenge is that when we've trained these people, they're going to go back to their countries and their facilities where there's no IPC program. So they get the IPC training, but they cannot continuously practice it. A few of them that do have programs to which they return to are doing some good work, but generally across countries, we found that a major aspect of it is this, the absence of IPC programs at national and at facility levels. And when we're training, a lot of the training that has been out there, which we corrected, is that the training has been targeted at frontline workers to allow them to solve a particular problem or to protect themselves. We don't have a lot of training that actually trains the practitioners who will drive the process and ensure that the countries take them seriously. In ICANN, we do have this particular kind of training that trains IPC practitioners. But we found that the absence of a career path meant that some of the practitioners we have trained, when they get home, I talk of, what do you call it, internally displaced and externally displaced IPC practitioners. Externally displaced out of Africa, they get jobs out of Africa, outside Africa, or internally displaced, they get back to their facilities because there's no career path, they're moved into other specialties. So you do have these people being trained, but they're not functioning. So the impact of the training is not very clear, is not very obvious. And so we also do the other thing. How do we advocate? And how do we get people to work with us to ensure that at national levels that IPC is taken seriously? One more thing I may say is, because there's no career path, because there are no defined things that separates the practitioner from the IPC, from the frontline worker that has been trained, many specialties don't see IPC as something that's supposed to be integrated into their specialty. They see it as, they've actually reduced IPC to 3 things: training for an epidemic or an event, PPE, and hand hygiene. Once those 3 things are sorted out, they're saying, so what does the IPC practitioner do? So there's a lot of work, because we need to incorporate the program so that they can see it as part of a whole climate and a system for creating a safe environment in hospitals. So I feel that if we can advocate for programs, if we can ensure that there are IPC practitioners who are trained, then you will have a movement, and they have a career path. They will even automatically ensure that they exist and that they're relevant within their systems. So our greatest challenge, if I come back to it, is that perception on the continent, which drives the other problems that we have, that IPC is training, it's PPE, and it's hand hygiene, and it's targeted at epidemics. So that in between that, there's no political will to do anything else. Thank you very much.
Thank you, Shada. And these are indeed also the elements that were highlighted by some of our participants. And I really would like to make it clear that WHO, but not only, other organizations such as ICANN and many others are working together to try to move, to change this situation, to advise countries to advocate for establishing specific curricula and career pathways. It is a long way, but we are committed to change the situation, and hopefully we will maybe organize a webinar in 5 years and have a very different scenario in a number of countries. I'm sure we can. So indeed, you mentioned this aspect of training during outbreaks. And for this reason, I would like to move to Professor Fischer, who is someone who has organized many trainings. He's chair indeed of the steering committee of the Global Outbreak Alert and Response Network, GORN. And in fact, I would like you to help us understand what is the role of training during the response to an outbreak. Does it really make a difference, or is it too late because health workers don't have the consolidated know-how acquired in previous training on IPC? Over to you, Dale.
Thanks, Benedetta. It's a good question. I'll try and be concise, but I'll just start by saying these types of webinars always remind me how you miss not meeting up together in person, because I see so many friends here and they're all just little Zoom images at the moment. So let's look forward to happier days. In answer to your question, I think if anyone thinks it's too late to train when there's an imminent outbreak or during an outbreak, then I think that clearly misses the point. And it's really about phases of the outbreak. I guess what you don't want to be doing during an outbreak is teaching the basics of infection control. You don't want to be doing mass mask fitting exercises, hand hygiene exercises, things like that. You'd like to think that all those basics, for whatever level, whether it's all healthcare workers or IPC practitioners, whatever training, that sort of baseline level is there already. But it also depends a little bit on what you call training, because I'd also call information sharing, buddying, audits and acting on those audits also as part of training. So if you consider that, let's say there's a certain level of baseline IPC expertise, then it comes down to readiness activities. Let's start there. Everyone knew in January, really, that this was on the way. And certainly by February, everyone knew it was on the way. So if countries, health institutions were not really preparing then or getting ready then I would say that was a mistake, because that was an opportunity to be ready. Now, when I say ready, it's not just about, as Sade just said, it's not, IPC is not just PPE and hand hygiene. It's what are going to be the new workflows. COVID is on the horizon, even if we don't have a case or we've only got a few cases. How have we adapted our infrastructure? What are our new workflows? What does triage look like? What are the isolation policies? These are all part of IPC that should have been discussions and implemented before the outbreak came. And this engenders tremendous confidence, I might add, when this sort of activities are happening, even in that readiness phase. But of course, even once the outbreak's going, there's nothing wrong with wandering around, looking for things that aren't being done quite right, refining them, and having adapted trainings, because now you can contextualize, you can refresh, you can do all these things to build on that baseline level ability, I guess. So as you know, in Goan, we have a 3-tiered training, and actually this is part of that baseline level, which is bringing in risk communications, community engagement, so the other pillars of response, including IPC. And when we have our scenario training, IPC keeps coming up. It's that adult learning, which Professor Magzoub discussed early on. Adult learning is the way to do it. Adults don't like sitting and listening to a lecture or reading a long document. So I think I hope that answers it. I know we've got time constraints here, but the point is that training really should never stop. It should be adapted. And I'm not suggesting that during an outbreak we should start teaching people the basics of IPC. Hopefully that's there already. But during an outbreak and immediately before an outbreak, we can surge, we can contextualize, and we can introduce the adaptive IPC response. I hope that's okay, Benedetta.
Thank you very much. Yes, it's a very comprehensive response, and thanks a lot for highlighting anyway the value of training during outbreaks in connection to previous curricula and experience. So now I would like to move to Professor Munters, and I know that the European Society of Clinical Microbiology and Infectious Diseases is probably the only existing society which has an international certificate in IPC, which is recent and relatively new. So I would like to ask you, Nico, if you can kindly talk about this program and what is the added value of this program or certificate to any existing national curriculum.
Thank you, Benedetta, for this opportunity to speak on UQIC's behalf here. And I'm very happy to answer this question. First of all, just to give a brief comment about the training program. It is indeed relatively recent. We started this program 2 years ago, 3 years ago actually. Had a little break due to COVID at the moment, but usually it should be finished by now, the first row of the training program. It is a pan-European training program in many different countries in Europe, having created training centers there. And the main objective of this training program is to put it in a nutshell, or say it in a nutshell, to fill the gap. As you have seen in the Q&A section, and many speakers before me have already mentioned it, actually the approach to training in Europe with regards to IPC, and I would say worldwide, is very heterogeneous, and in many countries education is not existent. So people have the problem that they cannot really be trained to become an IPC doctor or an IPC nurse in their own country. And this is a major need that we found would actually create an even bigger problem in the future with regards to pandemics such as COVID or also MDROs rising. So we created this training program as a pan-European program and eligible for everyone who actually wants to join, either doctors or nurses. And we based it on the core competencies that have been published by ECDC and by WHO to create also an international recognizable program, and also accredited this with the ECME and with the UMS, with the Multidisciplinary Joint Committee on Infection Control from the UMS, the European Association of Medical Specialties. And this training program has been going on now for 2 years, and I think is quite successful because it has been bringing together people, and this is the added value to national curricula, that we wanted to have this program and these trainees that in the future will become IPC specialists as a kind of seed that grows out to become a plant and a tree with branches that creates a network across borders in Europe. Because as you see with all pandemics going on, education is very, very important to have also interventions and communication between countries in a better way. And not every country does just what it wants by its own. And this is something that we all are working together in this year. And this is, I think, the added value that for countries in which there is no training program available, the UKIC training program can fill the gap here. And in countries where are training programs, it can provide a European competence, a meta competence. Usually, if you're a trained expert in IPC in France, you only have the view of the country itself. You don't know about the healthcare systems around you, the healthcare system in Germany or the UK, for example. You don't know really about differences in sociocultural context or differences in epidemiology. And this is also something that the training program from UKIC wants to provide a European view on the perspective, to have people that have finished this training program successfully to be able to work in their own country, in their own hospital or public health agency, and serve as a focal point and contact point for others in other countries, so that hopefully in the future, we will have the opportunity to contribute to the harmonization of infection control and the standardization of procedures in Europe using these new generation of IPC experts who then will have been trained in many different European countries and not only in one country. So this is in a nutshell the idea of the pan-European training program.
Thank you very much. So in fact, I really wanted you to give the example of this available certificate for people to look at the website and really understand if they could benefit from this program, whether they are in Europe or also outside Europe. So thank you very much, Nico. I think it's an incredibly positive example, obviously to be grown and developed, as you said. Okay, so now we have our last panelist, and this is Ermira Tartari. As we said, she's an IPC professional, and she's been part of Professor Pittet's team, and they have implemented an international train-the-trainers program, which is described also in a scientific paper, and it has been very successful. However, I would like to ask her also to talk about how an international train-the-trainer program can be sustainable at the country level. Does it last over time, or the impact is diluted afterwards? Can you give us your experience, Ermira? Thank you.
Thank you, Benedetta, and thank you everyone for organizing this very interesting webinar. I'm pleased to be here today on behalf of Professor Pittet, who unfortunately could not make it, and he sends his apologies. So the WHO Collaborating Center on Patient Safety at the University of Geneva, led by Professor Pittet, developed a Train the Trainers course in hand hygiene. So we go a bit more narrow now from IPC that we discussed so far to hand hygiene, based on the WHO multimodal hand hygiene improvement strategy. This is a standardized course for training IPC professionals, practitioners, specifically in hand hygiene, which includes the training also of auditors in hand hygiene compliance monitoring. As we know, hand hygiene compliance monitoring is one of the key performance indicators established for IPC. We have organized these by conducting a 3-day simulation, face-to-face simulation-based training, also participatory and experiential learning. And this was launched back in 2015 with a pilot in Brazil, where it contained various concepts of hand hygiene, surgical disinfection, and various other aspects, and auditing, as I mentioned. And so far to date, it has been launched in other countries such as Malaysia, Iran, Spain, Thailand, Japan, Turkey, and there have been requests from other countries. this has been encouraged and pushed by demands of IPC practitioners wanting to come to Geneva to experience the hand hygiene and to be trained with professionals in hand hygiene at the Geneva hospitals. This has been successful. We have monitored and evaluated the impact that such training has had through a before and after course evaluation study. And we did identify in 3 countries, Mexico, 2 regions in Mexico, Jalisco, and another region, and also in Spain, where we checked that following 6 months, 1 year, and 2 years after such training was conducted, the impact of the improved knowledge was sustained. Also on sustainability, when since the course was done back in 2015, for example, in the first pilot country in Brazil, practitioners, IPC practitioners there have formed a network of IPC practitioners in all of Brazil. They have translated the material, course material, both in Portuguese and in English. And until today, 5 years after, there have been successful results, and such first training has encouraged the replication of at least 25 hand hygiene courses with more than 800 trained IPC professionals nationwide. So we can understand the impact, and this is only one example. I have examples from other countries that have engaged also in other IPC initiatives and hand hygiene initiatives, one of which is they have formed a network of IPC professionals to promote the 5th of May Hand Hygiene International Day, and they conduct several activities. So we have seen that they have been able to deliver the trainers that we trained initially through this Train the Trainer course, have actually been able to train other healthcare workers, doctors, nurses on hand hygiene, but also other IPC professionals in different cities, regions within their country. So this has been like a blueprint of blueprint material to share with other professionals. So that is what I want to share. Thank you.
Would you like to remind our participants in which journal this paper is published?
So the paper has been published in the Antimicrobial Resistance and Infection Prevention Journal, the ERIC journal. Okay, yes.
So they can search under Professor Pité or your name.
I will share the link in the chat.
Great. Okay, so we are at the end of our time. So I just would like to, first of all, thank a lot the panelists for their interventions. Apologies, the time was limited, but I think it was invaluable to get your view and experience. Also, I would like to let participants know that on the WHO Global IPC Network web pages, you can find one page where all available IPC certificates or courses worldwide are listed. And I put the link also in one of the chats, in one of the answers I gave to the questions. So you can find courses there. Of course, WHO commits to really expand all this area and advocate with countries to progress with IPC curricula and also with career pathway. But I would like to now hand over to my colleague, Ana Paula Coutinho, who is the IPC focal point and lead in our European office for the main conclusions.
Thank you very much, Benedetta. So I just would like to say a few words. First, to thanks and congratulate all the panelists. It was really nice to hear, so much insightful ideas from Professor Mohi, from Professor Chabet, from Professor Dale, Dr. Anita, and from Nico. It's been an honor, true honor, to work with you in different occasions through WHO. So on behalf of WHO, I really would like to thank all of you for being our partners for so long and making IPC so much better. I also would like to thank our fantastic ADG, Dr. Hanan Balki, and our shining star, of course, Professor Benedetta Legranzi, for really the leadership and for, you know, really shaping IPC into a much, much better way. So the impact and their leadership on my professional life, and I believe in the professional life of many IPC experts, it's really incredible. Also would like to thank all participants for having the time, taking the time to be with us today. And of course, to thanks our colleagues from CDC and ECHO for organizing today's webinar. I have 3 points to make. So the first one is about education. As we know, education is the most powerful weapon which we can and we should use to change the world. So infection prevention control expertise does make the difference to combat antimicrobial resistance, to prevent and respond to outbreaks, and makes quality of care much better. The second point I would like to make is about that we really need to take action now. And for that, it's critical to increase availability of in-country IPC knowledge and expertise. And of course, to enhance IPC education, training, and knowledge across all disciplines. We talk a lot about the IPC expertise for IPC experts, but we also need to ensure that, you know, in other disciplines, this is also ensured. Antimicrobial resistance, small or large scale outbreaks, disease X that we always will have a new disease, will not succeed in the presence of a robust and sustainable IPC expertise. And my last point, it's about that we need to have determination. I think to achieve IPC expertise is like running a marathon. When you run a marathon, you run against the distance, but not against the time and not against the other runners. So we, together with the health worker family, we are running against and we are fighting against antimicrobial resistance. We are the first to respond to outbreaks, and we are the first to prepare for outbreaks. So thank you very much, all of you, for taking the time to patiently listen to us. I am sure it was very helpful, it was very insightful, and will inspire your work. Be safe, be kind. Thank you very much, and goodbye.
Thank you so much, Ana Paula. And I know how much you are translating in action these principles in supporting European countries. So I would like once again tell our users and our participants that WHO is there through our regional and country offices, really to support you to move forward this agenda on IPC training and expertise creation. So with this, I thank everybody, and I remind you that you will receive the presentation from ECHO and also by email, and also that you should do any possible effort to take advantage from continuing professional development. So many thanks all of you, and see you in the next Global IPC webinar. Goodbye, everybody.
Bye.
Bye, everybody. Thank you.
Thank you again.
Bye, everyone.
Thank you very much. Bye.
Bye-bye.
Thank you.